before you go into a procedure, don't just accept the fact that you're having an angiogram. There are a lot of questions that you need to ask, not only about skill set, but what are the tools you plan to use and why? Why are you using those tools? Do you take a less is more approach in treating my vessels? And what is your success rate? What are the contingency plans? What if you can't get through a blockage coming down from the top where they poke in the groin? Do you come up from below? Will you poke in to an artery in my foot, in my calf, or behind my knee and try and come up what they call a retrograde approach, coming up from the bottom? Because sometimes if they can't break through, these blockages typically have a cap on them, a hard cap. And if they can get through that cap, it might be more, the plaque below might be more amenable, and there might be a little pathway to get a wire. The whole key to these treatments right now, and actually why I liked that previous laser, the previous laser did not rely upon a wire guiding it, but every other device on the market right now requires that a wire actually be able to penetrate or traverse through a blockage or a narrowing in the artery in order to be able to treat. Now, sometimes they'll go into the artery wall, and that's what we call going subintimal, right? They're poking into the artery wall and they're creating a new channel. Those aren't typically as durable procedures as doing what we call going, true lumen or in the native vessel or in the main part of the vessel, but that's not always possible. And if they can try it to get blood flow and at least give you time, all of these procedures, every single one of these procedures to treat blocked arteries, it's temporary right now. And the goal would be is to make them more durable. And as we move forward and the technology I see coming to market now and over the course of the next 5 years, I think we're going to see higher patency rates, more durability. It doesn't mean that you as the patient should not be a partner in your program. You've got to do your part. With peripheral artery disease, there is so much that you can do to prevent and also to stall progression of this disease. So much. The medications, doing as prescribed, lifestyle modifications, and especially walking. I know it's easier said than done. And it's painful. But if you think about walking through that pain and with every single that hurts, that your body is responding with a new collateral vessel that is dilating and helping to reroute blood flow around that artery. It's that pain. You've got to say, you know what, thank you so much, for telling me that you are building my collateral network of vessels. And so right now, when it comes to these treatments, I like the less is more approach, if at all, if they're going to treat at all. First and foremost, always walking, always trying to see how far you can get first. But then saying to the doctor, great, you know what? I just need that much more blood flow, a little kiss of the balloon. Less is more, conservative is better. Tiptoe in, doctor, and just give me that much more blood flow so that I can walk further without pain, so that I can continue to build my collateral network of vessels. That's still your body's best protection against amputation, is those collateral vessels. We have people that have had their blockages opened up and then they close up a few months later or even a year later, and yet their test results for their ankle brachial index, that's the ABI test where you have the blood pressure cuffs on your legs and your arms, and they're still pretty high at 0.8, 0.7, clear up there. And that's really good. And it's because of their collateral network of vessels. And people ask, well, should I get treated? Because they're just scared that, well, what's going to happen, down the road, is it going to get worse? Well, you know what? It may or may not, but at the very least, those collateral vessels are more likely than not going to sustain your leg if you can keep walking. At that point, when that blockage is there, you will have built all these collateral network of vessels, and you may not even need that main artery to live your life and to have a good quality of life. So, but I do think that we're going to see these